Hello, my name is Cordell. I'm doing an exam of the ears, nose, throat, neck. This is Miss Jones. Miss Jones, I need consent to videotape this and also consent to make a YouTube link and video with this. Do you give consent?
Yes.
Okay. So I am going to do this exam. At any time, feel free to let me know if you're uncomfortable or if anything hurts and stuff like that, okay?
Okay.
All right, so I'm just going to begin with your head. I'm going to look at your head. I'm going to see there's no lesions, there's no bumps. I'm just going to lightly palpate, okay?
Okay.
So I'm just going to grab some gloves.
Is on your order, Mina.
All right, and I'm going to be able to do this exam. Okay. May I proceed?
Sure.
Okay, thank you. All right, so I'm just gonna feel the back of your head. Just gonna feel it. There's no lesions, there's no bumping, there's no sores and stuff. I'm also gonna inspect your face, okay? So I'm just gonna slightly take this mask off. All right.
Okay.
And there's no lesions on the skin. Okay. And I'm gonna put your mask back on. Okay. So I'm gonna now proceed to your eyes.
Okay.
All right, I'm looking at your eyes. They're equal. There's no discharge, no redness. I'm gonna actually just pull down and look inside. They're nice and pink. There's no discharge. I'm just gonna look at your sclera. All right. All right.
Okay.
Also, what I'm gonna do is ask you if you can just look straight at me. All right. And I just wanna actually check some of your cranial nerves. Okay. So I'm just gonna take the mask off so I could actually do that. And what I'm going to do is actually look for eye movement, deviation, nystagmus, and also if there's any abnormality. Okay?
Okay.
So at any time, please let me know if there's any questions or concerns.
Sure.
All right? So I want you now to look at this. I'm going to just move your eyes, not your head. Up. This way. Down. Okay. Are you able to stare at this for me? And then, okay. I'm just gonna actually look at your eyes to see coordination and also check and see if there is any restriction, okay? To
Okay.
light. So just
Sure.
look forward. I'm gonna bring it in. Okay. Then I'm gonna look for coordination. Oh, great. All right, I'm just gonna pass this over. Sorry about that. Okay, same thing. All right, just look forward to me. Okay, perfect. Thank you. I'm going to look inside your eyes just to look at your cornea and the structures behind your eyes. All right.
Okay, sure.
Okay, just look at me. Okay. All right. I'm just going to look, just keep looking forward. Okay, good. Looking good. Thank you. I'm going to do the same thing here. All right. Keep looking forward for me. Okay, perfect. Okay. Any pain or discomfort?
No.
Oh, okay. Okay, sounds good. So that concludes the eye exam. I'm going to actually look in your ears now. So for your ears, it looks like asymmetric. There's no bruising, there's no lesions, there's no discharge, okay? Can I look at the other one? Let me come around. Okay, great. All right. Do you have any pain?
No.
Any popping or anything like that?
No.
Okay, so before I go in, I'm actually going to do a ringing test. Okay? And it's a Renee's test. And what I want you to do is tell me if you're hearing this in both ears, one ear is louder than the other, or you're not hearing it at all, okay?
Sure.
So how does it sound?
I heard a little.
Okay. Is it in the both ears? Can you hear it clearly, like vibrating? Could you hear the ringing?
Yes.
Okay. Alright, so I'm going to actually do it at this ear here. I'm going to put it right this side. So tell me when you stop feeling the vibration or hearing it.
I'm not hearing
Okay, are you hearing it now?
it. No.
Okay. Alright, so I'm going to actually do this side and let me know. So I'm just going to have you tell me the vibration. Okay. Are you hearing anything?
No.
Alright. Okay, so what I'm going to do is I'm going to clog one of your ears. I'm going to just close it and I'm going to whisper something and I want you to tell me what I said, okay? Apple.
Apple.
Pear.
Pear.
Okay, thank you. Alright. Alright, so now I'm going to actually look with the otoscope and I'm just going to look at your internal ear, okay? So I'm just going to look with your internal ear. Please bear with me. Tell me if there's any pain, discomfort. Okay?
Okay.
Alright, any pain?
No.
Okay. So there is just a little bit of wax, but your eardrum looks good. Okay?
Okay.
I'm gonna look in the other one. There's no redness or discharge or buildup of pustules or anything like that. Okay. Looks good. Alright, there's no redness, irritation, or discharge in that ear. Okay?
Okay, thanks.
Alright. So now we're gonna move into the mouth. Alright?
Okay.
So for your mouth, what I'm going to do is I'm going to take a look at the lips. I don't see any cracks. Did you have any bleeding?
No.
There's no bleedings. Could you smile for me? Okay. And could you go like this with your tongue to the side and the other side? Okay. Good. Alright. Could you say Alright. And I'm just going to pull down. Alright. I just want to look inside your mouth. Alright, good. And I'm just gonna take this and look. Okay. Alright, and then what I'm gonna do is I'm just gonna look and see your teeth. There's no breakage, there's no cavities. Okay. Say after me. I just wanna look at your soft palate. Okay. Alright. What I'm gonna do is I'm just gonna do a tongue depressor so I can look at the back and look at your tonsils and uvula. Have you had any tonsil surgeries or anything like that?
No.
Okay. Say after me. I'm gonna stretch down. Okay, uvula is intact, tonsils is 1. Okay, thank you very much. Alright, so I just actually want to also look under your tongue. Say after me. Okay, oh perfect. So your saliva gland and stuff. Okay, this looks good. Alright. I'm just gonna change my glove so I can palpate the inner parts of your mouth.
Okay.
Slightly. Okay. May I proceed? Okay, so I'm just checking to see if there's any lesions, there's any bruising, any tenderness, any bleeding, okay? Alright, good. Thank you. Appreciate it. Okay, looks good. Alright. What I'm gonna do, I'm just gonna clean my hands. What I'm gonna do is I'm actually just gonna look and palpate. I'm looking at your face. I'm gonna check your sinuses and stuff. So let me know if there's any pressure. Do you have any pressure here?
No.
Okay, so I want to feel your. Okay, so this is your temporal, lower temporal artery. I'm palpating. Okay. Alright, and do you have any pain? So now I'm going to look at your lymph nodes. And this is the anterior, Lord. And then we're going back here. And this is the posterior. Then I'm just gonna slightly palpate, okay?
Okay.
Okay. And may I just look, open your shirt a little bit here so I can look?
Sure.
And this is a mandible. Okay. And I just want to feel, okay, here. Subclavicle. Alright. Okay. Could you turn your head this way? To your right? Okay. And to the other side for me? Okay, great. I'm just gonna feel here. Alright, and this is the submandible. And then, okay, good. So for your mandible, could you open and close for me your mouth? Like you're gonna chop? Close. Alright, good. Alright. So what I'm gonna do is now I'm gonna ask you if you could stand for me. Because I wanna be able to palpate your thyroid. Okay. So I'm gonna stand this way and I'm gonna be right at the back of you. And I'm gonna just slightly palpate, feeling the trachea. Okay, I'm just checking to see if there's any goiter or any enlargement. And I ask you if you could swallow for me. Okay, great. All right. Thank you. Okay, thank you very much. All right. Do you have any neck pain?
No.
Okay. Let me just look at the back of your neck. There's no brudeness, redness, any opening of the skin. Okay. Thank you. I appreciate your time. All right.
Thank you.
All right. So this concludes the ear, neck, throat exam. Thank you.